Well, good evening, everyone. Thanks for joining us for tonight's presentation on medical career beginnings. Before we get started, just some brief housekeeping. This presentation is being recorded and is being simulcast on our Pre-Health Professions Facebook page. So if you'd like to ensure that you don't end up on camera, you can leave your camera off. Otherwise, feel free to have it on. Everyone loves to see faces every now and then. So we're joined tonight by Dr. Allison Durham, Washington College class of 2014, and Rachel Bailey, a first-year medical student at the University of Maryland, Washington College class of 2019. I'll do a brief introduction for both of them, and then Dr. Durham, if you'd like to begin by having seniority, you can speak first, and then we will turn things over to Rachel. I'm sure we'll have plenty of time for questions and answers. So, Dr. Allison Durham is a graduate of nearby Kent County High School, majored in biology and minored in chemistry and philosophy at Washington College. She then completed 2 years of research in the National Institutes of Health Postbaccalaureate Intramural Research Training Award program studying HIV. She received her MD from the University of Maryland School of Medicine in 2020. She is an author of 11 scientific publications and is a member of Phi Beta Kappa and the Alpha Omega Alpha Medical Honor Society. Last year, she matched into the otolaryngology head and neck surgery resident training program at the University of Utah in Salt Lake City. Rachel Bailey, class of 2019, is a first-year medical student at the University of Maryland School of Medicine. She graduated from Washington College with a BS in biology and a minor in public health. While a student at Washington College, she was involved in the Student Events Board, Residence Life, and the Multimedia Production Center, and was initiated into Phi Beta Kappa. Dr. Durham, let's get started.
All right, everyone. I'm so excited to talk to you all today. Let me just get into my, sorry, I'm not as probably good at using Zoom as you guys are. Okay, and then I think, okay, can you guys see my slides or can you just see, can you see everything?
We can see everything. You got the presenter view on.
Shoot, okay. There we go.
There we go.
Okay, so I'm just gonna talk just for quickly, I'll watch the time about my experience in going from WAC to now being a resident in the ENT program at the University of Utah. So the caveat is that this is my experience, so in my journey, so yours may look very different, and there's nothing wrong with that, but this is just kind of, I would thought to give you guys a little starting point, a couple tidbits, things to think about that you might not have thought about, and then feel free to ask me questions at the end or email me. I'll have my email at the end. So my journey so far, like Phil said, I got my bachelor's in biology at Washington College. So this is me at graduation with my mom. And then I went on to do post-baccalaureate research 2 years with the NIH. And then I went to University of Maryland for medical school, completed that, and then just recently, well now almost a year ago, matched into my surgical residency in otolaryngology, head and neck surgery in Utah. Never in a million years I would have thought that I would end up A, in Utah, or B, as a surgeon, especially not a head and neck surgeon, because I didn't even know what that was when I was in your shoes. So first piece of advice is stay super open-minded, because you just never know. And then this down here is a picture of me operating. And no, I'm not the one right in the front. I'm in the corner doing something that's not as important as what these two real surgeons are doing in the front. But at least I'm in the OR. Okay, so first I'm gonna bring it back full circle to my experience at Washington College at the end. But first I was just gonna talk about my experience doing my 2 years of research between undergrad and medical school. So I did the post-bac ERTA program, which does still exist. I looked it up. I ended up doing mine in the International HIV STD section of the Laboratory of Immunoregulation, which is part of NIAID. So my claim to fame there is that Fauci was my boss's boss. And so I did get to meet him before he was famous, well, extra famous now. So I published a lot of papers there. I got to travel to conferences. I know it's hard to dangle traveling in front of everyone right now, but hopefully things will get better. So great. I got to go to Boston, Seattle. That was all paid for. I got to go to Copenhagen, Denmark to meet with collaborators on research. And then I think the most important part is that I did get to work with some amazing scientists and mentors that, I kept in touch with them even after I left and was in medical school. And then I do think that spending that time doing research full time, even if you are not interested in research at all and you just want to be a physician, it is so helpful to get those research skills and then to be able to interpret primary literature and think critically about papers that are coming out. Because as a physician, or really any healthcare profession, you are going to be a lifelong learner, and the majority of that learning will come from primary literature. My other little tidbit here is that I think, at first I really didn't want to take 2 years. I thought it was going to be too long. I wanted to get my life started and get into med school, but I think 2 years was a nice amount of time because it took about 6 months to get sort of situated in the lab and get some data. And then I was really productive for the last year of my time there because I had done all the groundwork, if that makes sense. So just one thing to think about. Like I said, everyone's journey is different. So moving right along, this is kind of my little undergrad versus medical school slide. I'm trying to anticipate questions you guys might want to know. In general, I think I'll let Rachel talk more about this because they have changed curriculum, and that's kind of across the country. More medical schools are going to a more of an integrated curriculum where you do clinicals earlier. Things are more integrated, but in general, your first 2 years are more lecture based, and then the third and fourth year are more clinical. I think the biggest thing is that learning in medical school, it becomes a lot more self-directed. You have to teach yourself a lot of things. You will have lectures and be taught things, but no one's going to give you a worksheet or problems necessarily to study for a test. You have to kind of figure out where your weaknesses are to a certain extent and make sure you fill all that in. And then and Rachel can kind of comment on this as well if she agrees. And then also your study habits definitely will be different. In undergrad, I was totally against flashcards, but that was how I survived in medical school because it is like drinking from a fire hose. I don't think that the content is necessarily much harder than what you probably have already experienced in undergrad. I think some of my physics and organic chemistry classes were harder conceptually than some of my medical school classes. It's just that the speed at which you have to learn everything is elevated. But the best part is taking care of patients. And I will say that that was also the most challenging part of medical school, is that transition into the third year. Because it is so different. You've been a learner in the classroom for so long, and then you kind of are thrown into this situation where you're basically taking care of patients all day. You're seeing that emotional stress of helping people and all the intricacies of the hospital. So it is a hard transition, but it's definitely worth it. And I think that you get through it, and you kind of take it in stride, but I'm happy to talk more about that if anyone wants to hear about it later. And then now I'm a resident or a surgical intern. So this is my day in the life because I never really could fully grasp what it would be like. So this is kind of an ideal day. So 5:30, you get to the hospital, make the list, so you kind of check on all the patients that are on your service, look and see if there's any labs, things like that. You get sign out from the overnight team. Then you round around 6 a.m. with the rest of the senior residents. You see all the patients really quickly, and then there's kind of a flurry where you're trying to write notes, get discharges in, get orders placed, call consults, and then by 8 a.m. you're usually going to the operating room or clinic, and you're kind of there all day. In the evening, you usually do a quick evening round to check on your patients before you leave, and then hopefully, if you're having a good day, you get to go home around 6 and eat, work out, study, whatever you need to do, prep for the next day. And then kind of in between, there's floor pages, things going off. So the caveat here is this is more of like a surgical day. Your day will look very different based on what type of residency you end up going into. But this is what kind of what I'm used to these days. And it's not like Grey's Anatomy, but I do like that show. And then this is what it's really like. You make clinical decisions on your own. You always have backup, but there are times that you are asked to make a quick decision because there's not necessarily time to ask a senior or an attending. So that kind of responsibility is definitely something that you have to kind of get used to, and that I'm still getting used to. As a resident versus being a medical student, you do have a lot more responsibility for your patients and putting in orders and things like that. It's kind of your name on the bottom line a lot of times. But I think the biggest lesson I've taken is learning to be humble and really work as part of a team. I don't think I fully appreciated the other healthcare team members, even as a medical student, until I became a resident. On a daily basis, I rely very heavily on my pharmacists, the nurses, the respiratory therapist. There's so many people, and the case managers, so many people in the healthcare system that you don't even know exist until you're a resident. And I'm constantly asking, pharmacists, like, what dose of this antibiotic should I give? And so it's really nice to work as part of a good team. And there's so much to learn from every single person that you interact with in the hospital, including your own patients and their families. And then getting comfortable being uncomfortable, because it is uncomfortable a lot of the times, and you know more than you think you do, but it's that's kind of hard. And then just bringing it full circle really quickly, I think that I have a really strong foundation of basic science. You guys will all get that at Washington College. That will kind of serve you well going forward. I think the liberal arts aspect, I minored in philosophy, that thought process, writing, reading is inquisitiveness has served me well. I think taking advantage of the research internship experiences that are offered by the college, and there's also lots of leadership opportunities, volunteering, that I think, the world is your oyster. So take advantage of those things because, and do something you really are interested in, because I think that will continue to help you down the road. And I think there's excellent pre-medical advising. I never was steered in the wrong direction by anyone. And with that, I will end with my best advice I ever received, which was from Dr. Verville. I don't know if this is the exact quote, but life doesn't begin when you get into medical school, doesn't begin when you get into residency, doesn't begin when you finish intern year. I've kept this with me my whole career since she first told me this in her office. So here's just a couple things I've done in the meantime. I got a dog right after I took the MCAT. I got married after my first year of med school, bought a house, and then this pictures down here are my plug for Utah. It's a really awesome place that I never would have thought I would have ended up in. And that's it. I will take questions after Rachel's presentation, and then this is my email. If anyone, you guys are welcome to email me anytime, even if it's like 5 years from now. So with that, I will stop sharing.
And Allison, if you don't mind, I'm sorry, Dr. Durham.
No, please.
If you don't mind, I'm gonna put your email.
Oh yeah.
Dr. Yost already did.
Absolutely. Yeah.
Put it in the chat. Okay. So we'll turn things over to Rachel. Take it away.
Hi, I recognize some familiar names. It's so nice to see you guys virtually. So I was sent some questions from Mr. Tickner about just what he wants me to talk about, so I'll go through those. So the first thing is about surprising things so far. So as in the little introduction, I graduated from WAC in 2019. I see another 2019 person here. And I loved WAC so much. I had a great time. I think it really did prepare me for medical school in a lot of different ways. And yeah, I was in the student events board, which I see some people here from. I was an RA, which I also see some people here from. But all of those types of things definitely helped me once I got into medical school. And then I did take a gap year. I was very anti-gap year for the longest time because like Allison said, I wanted to I was scared that that extra year was gonna like put me so far behind where I wanted to be, but I will preach gap years to anyone who asks me about it. After graduating from WAC, I moved to Pittsburgh with my freshman year roommate. We just found jobs and we're like, let's just do this. She's going into PA school. So she was a scribe, and then I did research at the University of Pittsburgh School of Medicine for a year, and I was a research tech. And I got that connection because I did a summer undergraduate research program that I just applied to randomly. And then after the summer was over, they asked me to come back after graduation as a tech. And I was like, you know what? Yeah, I'm going to come. I'm going to move all the way to Pittsburgh. I have no connections there and just do it. And it was great. And I loved it. It's very cheap for rent. So if you want to do that with your friend, I highly recommend it. It's a good beginner city. And then after that, so I applied my senior year at WAC, and then I heard back during my gap year. So yeah, I'm gonna go over some of the questions that I got from Mr. Tickner. So surprising things so far. So like Dr. Durham, Allison was saying, she was saying that things come at you really fast. So I just finished my GI block. That's my most recent block. And to put it in perspective in numbers of how fast things go, my friend tallied how many diseases we learned just about your digestive tract, and we learned 180 diseases in 4 weeks. And we are expected to know a lot about those diseases. But you know, what I was surprised about is that you really can keep up. Like, it sounds crazy, but if you get into medical school, it's because they have faith in you that you can do it. And that's one of the biggest things that I had to learn the hard way, but like, you can keep up and you can do it. And there's a ton of support once you get into medical school, like to help you, you know, if you need more help in a certain class or anything. So like, it seems like a lot, and it is, but you have support to help you get through it. What I did feel prepared for is, I know you guys know, and I don't know how things are now that we're all virtual, but for every single class I had to take at WAC, pretty much it was free response. All of my exams, I was writing 4 pages on Dr. Verville's exams. My hand was hurting from how much I was writing, but all of that, as hard as it was, hi Jenny, as hard as it was going through that, it really prepared me to know how to study. Because once I got to med school, everything is multiple choice. So I was like, multiple choice? What? I don't have to answer everything straight from my brain. Like, I actually have like guiding things. And that's really different from other big schools where they only take multiple choice. So they have like help in that way, but I felt like there was no like trick I could take like when I'm taking like these types of open note tests, because like I just have to know it. I've had tests from like Crockmole where I had to draw things, and Dr. Verville, I had to like draw like diagrams of something. So you have to know it, and all of those skills that you learn while you're here taking these super long science classes, like exams, they're going to help you once you get into medical school. And I think that's a little whack plug that I think, because I was talking to my friends from school now, and I'm like, wait, you guys didn't have open-ended everything? And they're like, no. I was like, that's shocking. But that really, at the end of the day, helps so much. So feel proud about that you're here and that you're at WAC and you learned how to study that way. Something I didn't feel as prepared for is relying on flashcards. I was never a flashcard person. You're going to learn about it if you haven't already, about Anki. And it's just, if you don't know about it now, you know, just take a little Google search and look. I can talk your ear off about Anki because like I said, I did not study that way at all. I'm like visual. I like drawing things, I like writing things out. I like talking to my stuffed animals about how pathways work. And I was never an Anki girl, but I have become one, and I can talk to you guys about that more. It's like really specific, but that's definitely how I feel about that. Something I'm glad that I did was take a gap year. Like I said before, don't worry about the timeline. Everyone's timeline is so different. Like, I took one, I have classmates that took like 5. So just go apply when you're ready. Like, that's something that a lot of advice I've gotten through the pre-med committee is just like, apply when you're ready. Don't worry about other people's timelines. Don't worry about how long. If you want to go get a master's, go get a master's. If you want to go travel for 2 years, go travel for 2 years, because once it starts, it does not stop. That's something I've learned. And it's gap years are great. Like, and that's the trend now. Most matriculants have taken gap years. It just prepares you in so many different ways. Some people do still go straight through, and I do have a lot of friends that just went straight through, but I am very happy with my gap year, and I am really glad that I did it. And also I'm glad that I had the pre-med committee to help me. I'm going to be the first doctor in my family, so I didn't really have any guidance in that way. And trust me, you need it. Like, you need it. I had no like basis of where to start, and there's so many things you guys have to check off. Like, that's just how it is. So there's a long laundry list. I know you guys got that packet with everything you guys have to do, prepare for your application. But you getting that packet while you're in undergrad, that detailed, is such a blessing. It's overwhelming. I remember leaving the pre-med like meetings in toll, and I was like, oh no, where do I start? Like, I don't even know if I submitted that form to open my file. Like, that's how I remember feeling. But all of that advice and all the resources that you guys have is so priceless. And I've talked to so many people from bigger schools with people that are less like connected with their advisors, and we have it so good. I'm just like, take full advantage. These people are here to help you, and they really do help you. Like, I'm sure all of you guys can count how many times you've just went into one of our professors or faculty's office just like, what am I doing? And that's such a precious thing that we have at WAC, and that I really do feel grateful for looking back. Something I wish I did. Some of you guys may already do this, but I really wish I scribed. I did research because I loved research. Don't feel like you have to do it, but it does, like, the way things are trending now, getting research experience is pretty crucial. And like Dr. Durham was talking about, it's very important to like, get that mindset early. And at Maryland, you have to do research. Your first year, you have to do a project. So it's gonna happen. And if you could do both in your gap years, I would. But so many of my friends did scribing, and I feel like they're so far ahead of me when it comes to like write-ups and like the medical terminology and just like feeling comfortable in a hospital. I know that's not, like, you get that through shadowing and stuff, but when you're a scribe, I feel like you really feel comfortable in a hospital because you're working there every single day, waking up early, you're getting used to that routine. Like my roommate that I was living with in Pittsburgh, she was a scribe, and she would like wake up at 5 to go to the hospital. I'm like, whoa. But that is really good experience. And like, my first major project at the end of my first year is submitting a write-up. And I like, this is going to be the first one I've ever done, but all the scribes are just like, guys, it's a write-up. And I'm like, okay, you have experience, I don't. And then lastly, since I see a couple people who are probably either graduates or third or fourth years, my advice for tips for your applications, if you haven't yet, so like I was saying before, there's a huge long laundry list. There's a huge checklist that you guys have to check off to apply to medical school. I know, and it sucks. And there's so many things on the list. And what's scary is you could be great and check off every single box on that list and still not get the like results you want in your cycle. But one thing that you can do to make sure that you're going to have a good cycle is how you tell your story. And you can have the stats, you can have the experiences, you can shadow, you can say, I've done this, I'm done this, and then you think you're okay. But when it actually comes down to like the actual application, every word that you have in your activities description, every word that you have in your personal statement literally will make or break your application. Like, and if you guys don't know this resource, there's a YouTube account called Med School Headquarters, and it's led by Dr. Ryan. And he's very brutal. He literally takes people who had 521s and 4.0s who did not get into medical school and pulls up their AMCAS application, screen shares it, and goes through it line by line with a big red marker. And he is brutal. These people are brilliant. Like, my stats were not that at all. But one thing I did have was I told my story, and I told it well. And although my stats weren't like 521 and 4.0s, like, I think the way I told my story with my personal statement and my activities descriptions really helped me get into a school that I really loved, which is Maryland. So you don't have to be that like 100th percentile stat person. And if you just tell your story well, if you share your experiences in a way that you show the impact it had on you and the impact you had on others, that'll set you apart from people who are simply checking the boxes, because they really want to know why you want to be a doctor. And I know it sounds hard to answer that, and it is, but you guys have great people to help you do that. I had my personal statement reviewed by the Career Center, by like everyone in the committee. And I think that extra touch of having people read it and seeing like, do I feel like I know who you are after reading my application really made the difference for me. So that was a lot, but if you guys have questions, like I can answer questions about gap years. I can answer questions about like being the first doctor in your family or like not having those kinds of things. But yeah, that's all I have.
And so I think we'll take questions for either Dr. Durham or Rachel, and if you feel comfortable, turning your mic on and asking it out loud, that's great. If not, we can take questions in the chat as well. I think we have a small enough group that we don't have to worry too much about people speaking over each other. And if we do, that's a good problem to have because it means there's a lot of questions, and then we'll figure it out from there. So please feel free, whoever wants to type one in or just jump right in.
I have a question. It probably goes more towards Rachel. Hi, Rachel. I miss you. But both of you, how did you finance for medical school? Like, do they offer a lot of grants? I don't really know how FAFSA works for medical school, and I'm also a first generation. So I'm the first one to go to college in general, but also first doctor in my family. So, it's really hard. So, yeah, how did you guys do that?
Yeah, I can go like leading up to then and then yeah. So I applied for FAFSA. All of them, I'm all on loans. I don't know if you're in-state or not, but like going to an in-state school definitely helps with tuition. Like I think for Maryland in particular, it's like 65 or something. And then with the in-state, you're like at 30,000, but still a lot of money. But yeah, you apply for FAFSA, and then for me, I had all of my bills like paid for through FAFSA. So it's all through loans. And that's just pretty much how it works. And then I don't know how the financing is after, like that can, Allison can talk more about that, but you can get scholarships. It's not guaranteed. And there are outside scholarships you can look for too. But yeah, like you said, Jenny, it's pretty much you just apply through FAFSA and then you get your tuition and all your bills covered. So specifically, they give you enough money to live in addition to pay for tuition and all those associated fees. So pretty much all of that is taken care of through FAFSA, for me at least.
Yeah, that was the same. I was also first doctor in my family and I financed everything. So it's fine. The AAMC, I actually have a little slide at the end. I'll paste. I have a bunch of resources or things that I think are helpful. But they have a lot of resources on financing and everything. And then just try to minimize your debt as much as possible now. I know that sounds hard, but try to do that so that you're not coming with a lot of undergrad debt if you can. But don't worry, you finance it, and then when you graduate from medical school, you start paying your loans back. But there's lots of payment plans that are like income driven. So because when you graduate and you're a resident, you really don't make very much money. I'm not making doctor money. I'm making resident salary. So it's based on that. And then there's like public student loan forgiveness programs and things like that. So there's lots of ways to do it. And so it's okay. It's just,
Awesome. Thanks.
Yeah.
I was really worried about that too. But you get a lot of support and there's a ton of people that can answer your questions for your situation too.
And I saw a hand up from Zita, and then there's a question in the chat from Colleen. So we'll go to Zita first.
Okay, hi. First of all, I just wanted to thank you both for your presentations. They're really wonderful and helpful. And I'm just happy that I got to hear both of your stories. And so I am currently a sophomore. I'm not 100% sure if I want to go to medical school. So I was wondering, were you both like always sure that you wanted to go, or were there any particular experiences either during your undergrad or even before that, like solidified the decision for you and made you feel like this is definitely 100% what I want to do after I leave WAC?
Yeah, Zita, I'm so glad you asked that question. That's such a good question to ask. I always knew I wanted to go to medical school. I did sort of briefly think about a few other things when I was in undergrad. even things outside the medical field. But I ultimately decided to go to medical school. But I strongly encourage everyone, if you haven't already committed, just think about other options. Some of it is that you don't even know that these exist. Like I didn't know, as much about PAs or NPs or, pharmacy. Like I did not really realize what their full role was in the hospital and how different it can look depending on what they're doing. There's so many other things in healthcare other than being a physician. And so I would definitely explore those other things. And if you go to medical school, that's fine. I'm not trying to drive anyone in any direction, but I think it's really important to explore all those options.
Yeah, I think I firmly decided that this is what I wanted to do in, I think, high school, but more so in freshman year, sophomore year. Like I didn't have any like aha moment, and you guys don't have to have one of those either, but if you do, that's great. I didn't have an aha moment where I was like, yes, med school is the thing for me, but it was just like all of my experiences looking back, like if what do I like once I learned myself more and like reflected and introspected on my personality and like what I enjoy, it always ended up being medicine. And that just took like a lot of different experiences. So I would suggest just throwing yourself in a hospital when it's safe to do so, and shadow. You can do volunteering, and just see if you like that environment. And I don't know if you're in between medicine and something else, or doctor and PA or nursing or anything, but once you decide you want to be in the realm of medicine, there are so many opportunities where you can just like do research and like talk to people and reach out to people that have those different career paths, and then figure out from there.
Thank you.
Mm-hmm.
And so Colleen is asking, and I think probably everyone would like to know this, what did you both do to prepare for your MCAT?
Yeah. So my MCAT was actually a major push as to why I took a gap year, because I did not feel ready when it was time for me to take my test. I think I was gonna take it like the summer before my junior year or in my junior year, because you have to apply the summer of following your junior year, and I was like, there is no way I am sitting for this test and feeling confident. So just overall, you're never going to feel like you're ready to take this test because it's so anxiety inducing and it's just a monster. But there are so many resources. What I personally did, I couldn't afford like taking one of the courses, but I've heard good things about those. So I pretty much self-studied with a free pair of books that my friend who no longer wanted to do pre-med gave me. She's like, these are in my storage unit collecting dust, so here you go. I was like, oh, thank you so much. And I just kind of took that, and I am a YouTube, like I love YouTube. I think it's so helpful. I just went on there and looked at a bunch of other people's study schedules, and I tried to do those as best as I could. And then that's how I kind of adapted. And I would suggest like more concrete detail answers is take as many practice tests as humanly possible. I would start with the test run resource ones first, like the Kaplan, the Princeton, whatever you're using. And then at the end of your study schedule, I would try to take the ones that the AAMC makes. And then take the scores you get on those to heart, the ones that the AAMC makes. And that way you can kind of gauge how ready you are.
Yeah, I agree with everything Rachel said. That's pretty much, that's part of one of the reasons I took a gap year, was to have more time to study for the MCAT. I studied it during my first gap year and then took it. I did use the Princeton Review course. I think if you can afford to do a course, I think it's really helpful because it was just hard for me to plan my own schedule and things. So, but yeah, there's lots of online resources. Everything Rachel said, I echo there for sure.
So Rachel, there's a question for you that you may have a tough time answering because of the word normal. What does a normal day look like as a medical student?
Yeah, as you guys know, my school life is a lot similar to what you guys are going through right now. So yeah, I've only known medical school in a pandemic. I do get to go in person with small groups of my classmates like once or twice every 2 weeks, and we get to do anatomy labs together and all those kinds of things. But it's not like how it was initially, is you would be in person every day for the most part for mandatory classes. But what my day looks like is I wake up and then there's lecture, but I watch it after it happens. But you can watch it live if you want. Like, even though it's online, I'm still not going live. I don't know. But yeah, you can watch lecture live or you can watch the recorded lectures after. And then I have mandatory class from 10 to 12, and these are small groups. So I get to just meet with a group of 5 other classmates, and we have small group faculty just give us some questions and some cases, and we all work through them together. And then I do that for 2 hours, and then I have lunch, and then I just start studying pretty much after I eat, whenever that is. And then I'll pretty much study like late into the night because I'm a night owl. I would rather stay up all night than wake up early, but that's just me. I have some friends that start really, really early in the morning and then go to sleep at a decent time, but I'm just not there yet. But that's what my day is like. But when you're in person, I think Allison can talk to you more about what that was like for her.
It was pretty much the same,
Okay.
except I didn't stay up late. I like to go to there, and then I would go to the library, and then I would work out around, study until like 6:30 or 7, work out, and then I would go home because I liked to go home and then be done for the day. So
Yeah.
pretty much the same.
Yeah, your day is pretty much spent just self-studying. And you're reviewing a ton of different outside resources, you're watching lecture, you're just trying to like keep everything straight, and your studying becomes your full-time job. If that sounds like something that's terrible and that you wouldn't want to do it, like give yourself some time, like really make sure medicine is what you want to do, because that's the reality. There's no way about that. That's something that's not going to change. Like, you're going to be studying for the rest of your life, pretty much.
Yes, actually, thank you. On that note, you reminded me, the test and the standardized test doesn't end when you finish medical school. It continues in residency. I just had to, and throughout medical school, you have to take step 1 and step 2. I just took step 3 a couple months ago. So that doesn't end. They get less high stakes feeling, but that doesn't end. So you always will be studying.
Yeah. Like, there's always a test to prepare for. It's not, if it's not the MCAT, it's step 1. If it's not, it's step 2, and then 3, and then boards, and then all this other stuff. So you have to be okay with that idea for sure if you want to go into medicine.
Okay, Dr. Durham, what did a normal day look like when you were doing your research?
Yes. So my research days were, I thought they were going to be a little bit more chill than they were, but they kind of weren't. I worked really hard. I liked to get to the lab early in the morning because I'm a morning person. So I would get to the lab around like 7:30 and then set up my I did some translational research. So kind of like bench to bedside. So I would set up my experiment for the day, my tests, and then kind of get that going. And then while the assay would be running, there's times that things had to incubate for an hour. So I would kind of read articles, help out around the lab doing other things. And then if I had data, I would start doing some data analysis, organizing my data, or starting to write papers kind of in the meantime. So it was pretty much like a kind of like a 9 to 5. That was the nice thing, is that it was pretty strict 8 hours a day. I didn't usually stay late. So I was able to go home at a decent time, like have a normal life, which for me, I really like to work out and cook and stuff like that. So I was able to do those things, take care of my dog. But yeah, it was good. And then there's like research lab meetings thrown in there, peppered into your week, but that was pretty much the standard.
Okay, there's a couple questions here. I'll group them together. For both of you, does University of Maryland have a very supportive or class-oriented feel amongst the students? So with regard to study groups, making friends, etc. And then how do you maximize your time more? Any particular strategies if you feel like you're taking too much time on one topic?
So we both went to Maryland, but I I was really nervous about that, honestly. I'm very slow to warm up person, but once I start talking and I feel close with you, I like don't shut up, but I'm very shy naturally. So I was like making new friends again after being in an environment like WAC was something I was super nervous about. But everyone in Maryland, they're super, super collaborative. Like, and that's something that drew me to that school. Because when a lot of people will say that, but they like actually are. Like, we have a Google Drive where it's organized by exam and everyone just puts all the resources they've been using into it, and it has everyone in the class has access to it. Like, some people put their Anki decks in there and that you could use it too. Like, if you're having trouble keeping up, there's some made for you. And then there's a bunch of practice questions that other people use. They'll put that in there, and like I'll make stuff and put it in there too, because everyone in our class pretty much wants to see each other succeed. Like, we're all gonna go through the ringer together, and I don't get to, even not experiencing them all like face to face and in person, I still feel this. Like, we're always in the group me talking during lecture or during small groups, like, what is this person saying? Like, those kinds of things. And then people are just really nice at Maryland, and like I can only speak for that for Maryland, but even being virtual like I am, I have already made like a really solid group of friends that I feel like I'm gonna be friends with for the rest of my life, and this is all like meeting them not in person.
Yeah, it was the same way when I went there. Everyone was super collaborative. Even if you weren't friends with someone that you had small group with, it was easy to talk with people and chat about your day, and then kind of talk about, studying and education. And people, it was the same when I was there. People were always sharing their resources. No one there ever tried to like bring other people down or sabotage or anything and try to, because they wanted the higher test score. Everyone wants everyone to succeed no matter what they kind of end up wanting to do, even though people start to kind of self-select along the road. But yeah, I have no regrets going to University of Maryland. I think it was a wonderful education, wonderful experience, and I think it really prepared me very well for residency.
Yeah, and in terms of the faculty too, like they all really, really want to see you succeed, and they're so kind, and they really take to like any feedback we have about how things could have been better. And I don't know how many other med schools are like that, but I do feel genuinely supported by the faculty. And like once you're a part of their family, I guess, like they want to see you succeed and they're going to help you no matter what.
So, Dr. Oh, I'm sorry. Go ahead, Rachel.
Well, there was a second part
Oh,
of that.
yes, there was. So, how do you maximize your time more? And are there any particular strategies you use if you feel like you're taking too much time on one topic?
Oh, I'm still on the struggle bus for that. I'm still learning. I'm still in my first year, so I'm working out all the kinks. I don't know when that's going to stop, but I'm still working on it. I got a planner and I tried sticking with it, but then it fell through. And like, I honestly, you just have to do a bunch of trial and error, and it's going to look different for everybody. Something that I try to do when I'm studying is I'll try to like give myself like the cutoffs, because I tend to like not give myself enough breaks. Like, I'll just keep going and going until like someone's like, Rachel, you've been down there for who knows how long. But I've been trying to like prioritize self-care more, and I realize when I do that, I am more effective in the long run. And that's something I've learned on my struggle bus, is that I need to like, if I prioritize that, I can be more effective with my time. So that's not an exact answer, but that's what I've learned so far. But I'm still learning.
Yeah, I maximizing time in residency is a little bit different. I don't think any of you want to be stressed out to hear about what that's like right now, but I agree with Rachel. I used to like make schedules and kind of stick to a similar outline of schedule every day in terms of when I studied, when I worked out, when I went home, as much as I could. And I think also setting limits on, I'm going to study this for 2 hours and then I'm going to go to this yoga class or whatever, I think is really helpful, because you actually end up being more productive in those 2 hours because you know you only have so much time. And then taking breaks. Also, I'm glad Rachel brought up wellness. you're going to start building those habits. If you haven't started now, start now, but also throughout medical school and then continuing into residency, you have to like learn how to make time for yourself, even when you're tired or you don't feel like you have enough time. I try to do that as much as I can now in residency, but I think if you do take those extra, even if it's 5 or 10 minutes just to meditate or something, you will be a better person, a better student, eventually a better doctor, whatever you end up deciding to be because of that, for sure.
Dr. Durham, can you say, maybe you don't want to because it sounds like you don't you don't want to freak everyone out, but what does an average day look like during your residency?
Yeah, so getting up super early. So like I depends on the rotation. So for me as a surgical intern, my schedule looks a little bit different than when I was like I covered the COVID ICU for a month. So that kind of was a different schedule, and I'm happy to talk more about that if anyone's interested or no one wants to hear when we're at COVID. I understand. I get into the hospital pretty early, around 5:30 or so. And kind of check on all my patients from overnight, get everything prepped, make little copies of all my notes for my senior residents, and then we round and see all the patients on our service, which is typically about 10 to 15 patients. We kind of see if there's any issues from overnight, and then we meet together as a group, figure out all the plans for everyone for the day, what orders need to be put in, who needs to be put in orders to go home, which that's a lot of work in and of itself. Does this person need a consult, which means I have to call, infectious disease or medicine or another service to say we need help with this problem this patient's having. And then we quickly get all that work done in an hour or two, and then we go to the operating room usually. And then you're kind of in the OR most of the day doing cases, and then in between your pager's going off, so you're like stepping out to respond to, sometimes there's emergencies on the floor, or you get a consult or something like that. So it's a little bit crazy, and every single day is way different. I haven't had any days that look the same. And then you kind of, depending on the rotation, I typically get home around 6:30, I would say, is an average, which is actually pretty good. It's not, that's about average. So yeah. But there's nights that you're, there till really late. So
I have a sub question off of that. And I'm sorry if you already talked about a day in the life of a resident. I came late because I'm running around like a mad woman.
I understand.
But I was wondering, since you're a surgical resident, when did you begin suturing and how? Did you have one of those cool suture kits, or did you practice on some feet?
Yeah, so I started suturing in anatomy lab. You get to do a little bit of suturing there, and then I didn't practice outside of probably medical school as much as I probably should have. Some residents will like take some, I did some, and like suture bananas, or like pig's feet are supposed to be like really similar to human skin. Although I will say the only thing that's like human skin is real live human skin, like living, breathing human skin. So, but third year is when I really started doing a lot, because again, Maryland is a great place. So this is going to be a plug for Maryland. The senior residents, surgery residents, came in and did like a surgery boot camp and taught us how to suture, and they were really amazing and tied knots. And so then you do 2 weeks of trauma surgery during your general surgery rotation at University of Maryland, and they're like, go sew this guy up. So people are coming with stab wounds and things, and so you sew a lot there. You sew in the OR. It's really something you should practice at home. So I did practice some at home before, but then you just kind of do more and more and more. And now, like, I'm an intern and doing it all the time, I suture people's faces and necks and all kinds of stuff. So.
This one goes along with it, actually. Another one for Dr. Durham. When did you determine that you wanted to specialize in otolaryngology, and were there other specialties that interested you? If so, how did you decide that they weren't the right fit for you?
Yeah. Dr. Will probably remembers this, but I was like, before I went into medical school, I was like, I'm going to do medical oncology. I'm going to be a hematology oncologist. I'm going to do blood cancers, lymphoma, leukemia. Like, that's what I'm going to do. That's why I'm going to medical school. And I stuck with that until my 3rd year of medical school. I mean, that's really what I thought I was going to do. I even did my research in leukemia research. So 3rd year, I picked surgery as my first clinical rotation because I was like, I'm not going to be a surgeon. I don't like it. I pass out sometimes when I'm seeing procedures. It's like, this is not going to be for me. And then I like did it. And I was like, oh shoot, I kind of like this, but no, medicine is going to be my people. So then I did internal medicine next. And I like remember coming home that very first day and like sobbing to my husband because I was like, I hate this. This is not for me. It was like immediate that I knew that I didn't want to do that, but I also didn't really want to do general surgery because I didn't love the abdomen. So this is kind of one of the things I'm saying, like, keep an open mind always, because it took a little bit of acceptance from myself that I wasn't going to do medicine, and I switched around my schedule, which was stressful, but I ended up doing a surgical subspecialty rotation just randomly. And ENT was one of the ones because I was like, people like that. And it was like the first couple days of ENT, I was totally sold. I loved it so much. I'm happy to talk more about ENT if anyone wants to hear about it, but it's a small field. We get to work in the nose, the ear, the mouth, the throat, airway. We also deal with cancer, head and neck cancers, peds. There's a lot of pediatrics within ENT. You get to use cameras, microscopes. I operate under the microscope sometimes, all the time. It's a huge field that is also very small, and it was very easy for me to decide, mostly because I didn't like anything else. Because even at the end of my 3rd year, I still tried to keep an open mind. I thought about ER medicine because I'm a little bit of an adrenaline junkie, and nothing else even compared. So that's a little different. I think a lot of my peers said they're like, I like everything and I can't decide. But for me, I was like, I hate everything but ENT. So it was pretty easy in the end to decide. And so around your 3rd year is when you typically pick.
Okay.
Going off of that, Rachel, do you know what you're looking at possibly? I know you have clinicals, but
Yeah, everyone I've always liked infectious disease, and I still do. And I'm not gonna know for sure until I'm in clinicals and I see what the day-to-day is like. Like, do I like what their day-to-day is like or not? I'm doing research, malaria research, which was actually my thesis topic at WAC. I'm doing malaria research this summer. And I'm gonna see more about that, but that's what I'm most interested in right now. I'm kind of like the same way. Like, I know what I don't like. I'm not an adrenaline junkie. Like, I don't like emergencies, like emergency medicine so far. But Maryland is huge for their shock trauma and everything. So we have a ton of people who are filling that gap in my class. But yeah, I'm super excited and I have a lot of time to figure it out. But I've always been interested in infectious disease, and that's why I did my research and also at Pittsburgh. But I'm gonna try to keep as open-minded as possible. And I'm learning a lot from Allison also, sitting here hearing you guys' questions. So yeah, but that's where I am right now. Oh, and I also really like geriatrics. So yeah, those are my two. When people ask me, I'm like infectious disease and geriatrics. I think I'm gonna try to do geriatric research the next chunk of time I get to do research on things. But those are my two. They're kind of like not related, but are. But yeah, that's where I'm at.
Well, the hospital in Chestertown is becoming an aging specialized hospital, and they are looking to hire geriatricians. Just putting it out there.
Yeah, I did take a Sociology of Aging class with Dr. Rios, and it was like the best ever. If it's ever offered, you guys should definitely take it.
So I don't see any more questions sitting in the chat, and it is 7:55. So this is like fantastic timing as we try to keep these to an hour. But I will offer you each the opportunity. If you have any final thoughts to share, feel free.
Yeah, I think final thoughts for me would be every journey is different. So don't feel bad if you do a different pathway or kind of do circles and then go forward. That's fine. Keep an open mind about everything from now on, because you just never know. I never thought I was going to be a surgeon, especially not an otolaryngologist. I never thought I was going to move to Utah. And I'm super happy that I did all of those things. Make sure you take care of yourselves. And then don't be afraid to ask for help, whatever you need. So on that note, my email is in the chat. So feel free to email me anytime, even if it's like 5 years from now. I'm happy to always help fellow WAC alumni.
Yeah, all of this is so overwhelming. I'm not that far removed from the application process, from taking the MCAT, from preparing for the MCAT, from figuring out what the heck I'm doing in my gap year. And it's a lot, and it's so stressful. And I think that was probably the most stressful time of my life. Like, I think I got a gray hair or something from just getting ready for that part. So I understand like what you guys are going through is so much, but you guys have to be confident in yourselves. And I always tell people, if this is what you want to do, like, don't have a backup plan, because that's what it takes. And having that kind of passion and everything, like, you have to put in the work. You're not just gonna magically get into medical school, but if you work hard and you put in the work and you like keep the faith that this is what you want to do with your life, you're going to be successful. So even if it doesn't work out the first time, try again, because that's the kind of like grit you need to like keep going for as long as we're going to be going for. And also, I am totally here if you guys want to have like a conversation about something specific, like interviews or applications. Like, all that's still pretty fresh in my head, and like studying for the MCAT too, like all of that. I talked to a lot of people about too, and I love helping you guys, because I felt like I was so helped. And I just want to make sure you guys have somebody, because it's nice when you have some like an alum to talk to who's kind of like going through what you're going through. So yeah, you guys all have, I have a lot of you guys on Instagram actually, but for those I don't, yeah, you guys can have my email for sure, and just hit me up whenever you want. As you guys know, I'm up all night, so I'm available.
Okay, well, on that note, thank you both so much for your time, and then certainly your willingness to be available for our students going forward, whether that's now or 5 years in the future, as Dr. Durham said. So again, everyone, I hope you enjoyed this, those of you who came, and those of you who are watching this recorded. I hope you enjoyed that as well. All right, thank you.
Thanks
Thank you.
everyone for coming.